Hello?
Mahardika.
Hi. Yes, yeah, I can hear you. Can you
Hi.
hear me? Okay.
Yeah, I can. It's nice to see you.
Yeah, nice to see you as well. I'm not sure if my connection is good enough for me to have a video chat, but we'll see.
Okay, well, it's no problem if we want to if you want to go audio only. I don't know. We can see.
Yeah, because I don't wanna like left out in the middle of conversation just because
Okay,
my
that's
connection is dropped.
no worries. Just go on
Okay.
to this. I'll do the same if that helps. I don't know. No.
Right.
Okay. So thanks so much for joining me here and chatting a little bit. I was really amazed or mesmerized by but when what I heard about your organization, and I thought it could have some good lessons for people anywhere. Um, so can you tell me a bit about yourself and about ASRI?
Yeah, sure. First of all, thank you for featuring us on your podcast. Um, My name is Mahardika Putra, but people usually call me Dika. I'm based in West Kalimantan, Indonesia. I am working as program director at ASRI. So I joined ASRI 2 years ago as conservations program manager and just recently got promoted to program director. At
Okay,
the moment, I'm overseeing conservation, education, and replications program at ASRI. So
awesome.
my background is in forest genetics and conservations of tropical endangered trees in Indonesia.
Can you
Besides working as,
Can
yeah,
you take a second and say what ASRI is and how long it's been in existence and what their mission is in general?
yeah. So ASRI's ASRI's established in 2007. So we in ASRI we believe that that human health and the health of environment are intertwined and are related to each other.
Okay.
So that is actually the basic of our foundations. And that is the foundations of the programs that we have in ASRI. We have educations program, we have clinic that gives medical services to community, and then we have conservations program, and we also replicating our program in a new national park. And since 2007 we are contributing to 80% 89% reduction in illegal logging in around Gunung Palung National Park. And
Wow.
also, we've seen reduction about 67% on infant death rate.
Wow. So where does most of the funding for the organization come from? Because I think you're giving these services free to the community, right?
Yeah, we're not entirely free. So the community can still pay us with non-cash payment option.
Uh-huh.
Most of the fundings that we got coming from outside of Indonesia,
Okay.
like Packard International, Arcus International, and then USFWS, Disney Conservation Funds, and many other donors that I can't name one by one. Um, and yeah, all of those donors were supporting our program and supporting our conservations program as well.
Okay. Okay. I didn't want to like get hijacked on that, like because you were talking about a lot of other interesting things, but I just wanted to see if you were where your funding came from as well, in case people were wondering if they wanted to do a program like
Hmm.
what funding sources they should go after, you know. But in any case, go back to the main focus of ASRI and how and you guys have you've been able to reduce illegal logging by 89%. You said. Um,
Yes.
and so how do these two things come together, the environment and humans, as the combined health? How does that work?
Yeah, like I mentioned earlier, our founder vision for ASRI, before she studying ASRI, she always see she always can see this interconnectedness and intersectional between health and environment. Human cannot thrive uh, without healthy natural ecosystems, that we are connected to each other, and that we're connected with our environment. And with that in mind, she go around the national park and then sit together with the community, and then spending hours and hours talking with them, try to understand what is the basic problem that the community has. And at the time, she asked one questions in the community: what do they need to get away from logging? Because she saw a rampant logging case here in around Gunung Palung
Okay,
National Park
it's pretty bad
area.
there. Hmm.
Yes. So at the time, community asking for two things. Community said that they need accessible and affordable healthcare and training in organic farming.
Oh wow.
Because because community feels that they cannot be working if they're not healthy, and then they also understand that the healthcare at the time, it's not accessible, and it's not cheap. Because our founder found one family that has to cut 60 big trees just to pay for C-section. And
Wow.
then it's very a sad situation. So
Wow.
that is the reasons why we established our clinic in 2007, so that community can access affordable and high quality healthcare,
So
without having to think that they need to pay with money. Mhm.
so you're saying that basically for many of these people, the only way they know that they can get money is by taking down the forest or the trees. And so when there's something they absolutely have to pay for, they don't really have any other options.
Yes, mostly yes.
Hmm. That's unfortunate. That's terrible. And so you guys are addressing this by creating a way for them to support themselves in other ways.
Yeah.
Oh, that's great. So, what was your background before you started working with ASRI?
Before I'm working with ASRI, I work as a university lecturer,
Hmm.
and I'm a researcher as well. I studied a lot of tropical endangered tree species. I studied their genetics, and then how using that genetic informations to propose for conservation's approach for that particular species.
That's
Yes, so I did a lot of that, a lot of that work.
okay. So this works nicely with your own background. I see. What do you think? What was your founder? What was her background?
So her background is a biologist first. So she studied, when she came to Indonesia, she studied orangutan for many years.
Hmm.
And then but then she saw, these situations, uh, and then she heard a lot of logging going on, and then she saw that it's related to health, and then she go back to the US and then studied a medical, and then she come back again, and then establish the foundations here.
Wow. Yeah, that's dedication for sure. Um, so, what are some of the lessons that you learned as a takeaway from the work that the organization has done? What do you think are the lessons that anyone could take from this?
um I think for me personally, I think I take three lessons. I think first of all, if we lose our rainforest, it's game over for all of us,
Yeah.
because rainforests absorb 30% of the populations. that we emit every year. It provides us with food, water, oxygen, medicine, climate regulation, so much more. And I've seen it in the community, you know, how they are connected with the forest, right? And then usually people like us who stay in the city oftenly forget that we're living in the same planet, you
Mm-hmm.
know, and we need to understand that we are living in the same planet, that every action we're committed to treat this planet eventually will affect us all. So it doesn't matter if you're staying in wherever in this world, you know, because we're living in the same planet, and that the, you know, that the destructions of the forest that we saw in Borneo will affect, you know, will eventually affect us all. And then thirdly, I think we also need to understand that we cannot be healthy and thrive without healthy natural ecosystems.
It seems
I
that
think that is
that
the
the,
most, yeah.
it seems that the people working with your organization are very academic, very high-minded. Are you also partnering with any universities to study the social effect of what you've done?
Yes, locally we're partnering with Tanjung Pura National Park.
Uh-huh.
Tanjung Pura University. It's a local university located in Pontianak
Okay.
in West Borneo. But internationally, we're working with Stanford University.
Oh, great.
And yeah, yeah, we're working with them. There's some paper that may publish soon about our work here in
Awesome.
Indonesia.
I'm looking forward to that.
Yes. Yeah, well, hopefully. We also partnering with a lot of NGO, local NGO here that working in the same landscape, like International Animal Rescue, Yayasan Palung, or Gunung Palung Orangutan Center for Protections. And
Yeah.
above all, we also working with a lot of, you know, with local government, national park officer, and Ministry of Forestry.
Oh, okay. So are have
Mhm.
they been a have they been a good partner with you, the Ministry of
Yeah,
Forestry?
yeah. Yes, they've been very supporting of our works, and I think the way that the government sees the relations between community and the forest is also changed, you know, over time.
Okay.
So instead of like using like law enforcements, they kind of like thinking about how to utilize community towards the sustainability of the forest. So I think that's a good thing to see nowadays.
Well, that is a good thing to see. Now, to my understanding, and I'm not the most informed person, um, the it's my understanding that a lot of the clearing of the forest that's done in Borneo is done for the creation of palm tree or palm oil plantation. Is that something that happens in your district?
Um, yeah, we've seen some oil palm company here.
Okay, and now
Hmm.
are they, if within your district there's more preservation of the forest as a result of your work, are you just seeing the palm oil plantations kind of look for other areas and go there instead? Is that what's happening?
Um, I'm 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 not entirely sure if they're looking for different areas, but I know that um, yeah, I know that there's a lot of company here, you know, there's a lot of company, and then usually they expanding in sizes,
Mm-hmm.
and of course they are becoming a threat to to natural forests of Borneo, you
Absolutely.
know.
Yeah. Uh,
Yeah.
can you imagine a similar approach to what you've been successful with, working
Mm.
in other parts of the world, perhaps in the Amazon or in any other place, the model that you
Yes.
created?
Yes, our partner, Health in Harmony, are now replicating our model that we, our ASRI models in Madagascar and Brazil. So they're just
Really?
starting in Madagascar, and then they'll soon begin launch the program in Brazil.
Wow, that's awesome. And so, what's the name of that organization again?
Health in Harmony. So it's funded. It's founded by the same person.
Oh, really? Wonderful.
Yes.
I would love to get in touch with her. That's fantastic. So, I don't know. I'm so impressed. Now, if people want to get more information, I did look at your website. It is in
Mm.
Indonesian language, right?
Yes. Unfortunately, it's in Bahasa Indonesia. We haven't really translated it into English.
However, I have to tell anyone who wants to look at it, if you look for it, if you look up ASRI Indonesia or ASRI Borneo on Google, they'll give you the option to translate it into whatever your language is. Like the Google will translate
Mm.
it for you, so you can actually read
Yeah.
about the work that you're doing, even though it's written only in Indonesian.
Yeah. Oh, that's awesome.
Well, I really want to say thank you for your dedicated work, and I think it's beautiful what you're doing, and I'm so glad to be one of the people who has the opportunity to share it with you or with the world, the work that you're doing.
Well, thank you for featuring us as well. It's an honor.
It is actually my goal. I'm also doing a video series in the next year or so, and I'm going to do
Mhm.
everything I can to come out and do a feature on your work when I get to Indonesia. So
Yeah, that would be awesome. Yes.
I'll be in touch with you. Thank you so
Yeah,
much
sure.
for joining me, and
Please
have
do.
a great morning.
Thank you. Thank you. You too have a great evening.